To begin the abdominal cupping massage treatment, place some cream or oil on your hands and then just hover your hand over the abdomen. Because this is such an emotional area, a sensitive area, people aren't used to being treated, you want them to take a couple of deep breaths in to adjust to your hand pressure in the area. Then you can do some effleurage around from the lower right side, around the transverse, and down the descending colon to warm up the area. When you're applying the cups to the abdomen, I like to apply them around the large intestine, around the colon. So here I'm going up the ascending colon, across to the transverse, and down to the descending colon, and I'm doing about 2 pumps for each cup. Now, if I were the president of massage therapy, if such a thing even existed, I would divert all marketing dollars towards promoting abdominal massage. It's incredibly underrated. Did you guys know that 70 to 80% of your immune cells are present in the gut? And there's this intricate interplay between the interstitial microbiota, the intestinal epithelial layer, and the local mucosal immune system. Another thing I'll do here is right across from the belly button, about 2 finger widths away, is a acupressure and acupuncture point, and also common trigger point called ST25. This functions to regulate the spleen, stomach, and intestines, and it also dispels dampness and regulates qi according to traditional Chinese medicine. Once the cups are on, I'll get the client to take nice, deep diaphragmatic breaths in, and that's going to help to activate the deep lymphatic vessels of the stomach. It's going to help if they have any congestion, if they have constipation, and it's also going to help with the immune system and to relax the client. Placing the cups over the abdomen is going to be really good for improving both female and male reproductive system function, and it's also going to elevate uptake and absorption of nutrients and increase digestive fluids, which is why we want to encourage breath as the cups are static, which is really going to help to get things moving in the area. After we've done the deep diaphragmatic breathing, you're going to slowly take the cups off. And as you guys can see, there's a little bit of marking on the abdomen, but I can assure you that usually that marking is going to go away within a couple of hours. So it's nothing to really worry about, and just assure the client that, hey, this is probably going to go away soon. Don't even worry about it. So once you take the cups off, you can actually reapply 1 cup to the area, and then we're going to do some dynamic movement cupping, and we're going to go around the colon. So this is going to be a good treatment for constipation. You really want to get things moving, and if things are really tense and tight in the abdomen, as they become when you're constipated, this negative pressure and circulation increaser is really going to help your client. So as you guys can see, I'm moving in a circle. I'm going around the colon, and I'm just keeping a nice even tempo. I'll usually do 1 pump in the cup, and I'll use kind of that smaller cup as you guys can see here. But it's up to you. You can use a larger cup as well. It's just personal preference. So I do that about 3 to 5 times, going all the way around the abdomen. While you're in the area, and never to be ignored, you should treat the diaphragm. The diaphragm is an area that is also undertreated. If you love working out, you may experience a tight diaphragm. If you're stressed out with your lifestyle, work, money, whatever it may be, you're probably going to have a tight diaphragm, and you're going to be chest breathing. So I like to do a little bit of dynamic movement cupping, a little bit of flash cupping with a silicone cup around the area, because it's a sensitive area around the lower ribs in the front. And as you guys can see, I'm just working around the lower ribs, around where the diaphragm would be, around the attachment sites, and you're trying to increase a little bit of tissue flexibility so that the diaphragm can move easier, which is going to help the organs, it's going to help with digestion, and it's also going to help with athletic performance. So I'll place one hand down just for client comfort, and then I'll work on the other side. You want to make sure that you're treating both sides with the diaphragm. And I'm working all around those attachment sites, around the lower ribs, doing flash cupping, dynamic movement cupping. And as you guys can see here, I'm just working all around that area, just doing some nice flash cupping to encourage a little bit of lift in that usually tied down and tense tissue around the lower ribs. I'll do this for a couple minutes. And then when you're done with the flash cupping, the movement cupping, finish the treatment as we always do with some effleurage, moving from the lower right side around to the left side, just to get everything moving after we've worked on it.